Human metapneumovirus, or HMPV, infects the respiratory system, affecting our nose, throat, and lungs. This virus can cause a range of respiratory issues from mild cold-like symptoms to more severe conditions such as bronchitis and pneumonia. Discovered in 2001, scientists believe it has circulated among humans for decades. The discovery was a significant milestone in virology, shedding light on a previously unrecognized pathogen. HMPV is part of the Paramyxoviridae family, which includes RSV, measles, and mumps. This family of viruses is known for causing respiratory and systemic infections in humans and animals. Its symptoms are often mild and easily confused with other respiratory illnesses like the common cold or flu. Common symptoms include coughing, sneezing, runny nose, and sometimes fever. Despite its recent discovery, HMPV significantly contributes to respiratory illness worldwide, especially in young children. It is a leading cause of respiratory infections in infants and young children, often requiring hospitalization. Most children will have been infected with HMPV by age 5. The virus spreads easily in settings like daycares and schools, where close contact facilitates transmission. Initial infections can be severe, but subsequent exposures tend to be milder as immunity develops. This pattern is similar to other respiratory viruses where the body builds a defense over time. Understanding HMPV helps distinguish it from other illnesses and highlights the importance of ongoing research into treatment and vaccine development. Continued efforts in this field are crucial for improving public health and preventing severe respiratory infections. HMPV typically presents with symptoms resembling a common cold or flu, making it tricky to diagnose. Common signs include a runny nose, nasal congestion, and a persistent cough. Fever is also common but usually low-grade and manageable with over-the-counter medications. Some young children may experience ear infections due to fluid buildup in the middle ear. In most cases, HMPV symptoms are mild and resolve within a week or two. However, severity can vary based on age, overall health, and underlying conditions. Individuals with weakened immune systems or chronic respiratory problems may experience more severe symptoms and require medical attention. While HMPV typically causes mild symptoms, certain groups are more vulnerable to severe complications. Understanding who is at higher risk can help in taking necessary precautions and ensuring timely medical intervention. Young children, especially infants under 6 months, are particularly susceptible due to their developing immune systems. Their bodies are not yet fully equipped to fight off infections, making them more prone to severe symptoms. Premature babies and those with chronic lung diseases face higher risks of serious complications like bronchiolitis or pneumonia. These conditions can lead to extended hospital stays and require intensive medical care. Older adults, particularly those over 65, also face elevated risks due to weakened immune systems and underlying health conditions. Age-related changes in the immune system make it harder for their bodies to combat infections effectively. Individuals with weakened immune systems, such as those undergoing cancer treatment or living with HIV/AIDS, are highly susceptible to severe HMPV infections. Their compromised immune defenses make it difficult to fend off the virus, leading to more severe health outcomes. These individuals may experience more severe and prolonged symptoms, making infections harder to treat. They often require specialized medical attention and longer recovery periods. People with asthma are also more vulnerable, as HMPV can trigger asthma exacerbations. These flare-ups can be severe and may necessitate emergency medical care. Proper asthma management is essential, especially during HMPV season. Regular checkups and adherence to prescribed treatments can help mitigate risks and ensure better health outcomes. HMPV is highly contagious, spreading through respiratory droplets when an infected person coughs or sneezes. These droplets can linger in the air for a short period, increasing the risk of transmission, especially in crowded or poorly ventilated spaces. These droplets can travel up to 6 feet, making close contact a significant risk factor. It's important to maintain physical distance from others, particularly if they are showing symptoms of illness. HMPV also spreads through direct contact with contaminated surfaces like toys and doorknobs. The virus can survive on surfaces for several hours, making it easy to pick up the infection by touching your face after contacting these surfaces. Preventing the spread relies on good hygiene and common-sense precautions. Regularly cleaning and disinfecting frequently touched objects and surfaces can help reduce the risk of transmission. Regular hand washing with soap and water for at least 20 seconds is crucial. Make sure to scrub all parts of your hands, including the backs, between your fingers, and under your nails. If soap and water are unavailable, hand sanitizers with at least 60% alcohol can be used. Hand sanitizers are a convenient alternative when you're on the go, but they should not replace hand washing when soap and water are accessible. Covering coughs and sneezes with a tissue or elbow helps prevent the spread of droplets. This simple act can significantly reduce the number of infectious particles released into the air. Used tissues should be disposed of immediately, and hands washed thoroughly. This practice helps to ensure that the virus does not spread to others through contaminated tissues. Avoiding close contact with sick individuals is also essential, especially for those with respiratory symptoms. By keeping a safe distance, you can protect yourself and others from potential infection. Currently, there is no specific antiviral treatment for HMPV. Managing the infection involves supportive care to relieve symptoms and keep the individual comfortable. This includes over-the-counter medications for fever, nasal decongestants, and pain relievers. Ensuring adequate fluid intake is important to prevent dehydration. In severe cases, hospitalization may be necessary for respiratory support and intravenous fluids. Research is ongoing to develop an effective vaccine against HMPV. Several approaches, including mRNA and protein subunit vaccines, are being explored. Despite challenges, an HMPV vaccine holds promise for reducing the burden of this common respiratory virus, especially for vulnerable populations.